Good morning, wherever you are. This is Talia Stone from ConferenceHype. Our segment will focus on strategies for treating sexual health concerns after breast and gynecologic cancer. From the 2026 JUL edition of Journal of Minimally Invasive Gynecology. Background: sexual dysfunction is a common but underrecognized sequelae of breast and gynecologic cancer treatment. Methods: many patients experience symptoms of genitourinary syndrome of menopause, including vaginal dryness, dyspareunia, and diminished sexual desire. Results: effective management of genitourinary syndrome of menopause includes non-hormonal options such as minimizing irritants, vaginal moisturizers, lubricants, the use of dilators, and pelvic floor therapies. Discussion: sexual dysfunction following breast and gynecologic cancer requires individualized, multimodal management. From the 2026 May edition of Journal of Minimally Invasive Gynecology. To show a complex fertility-sparing resection of stage 4 endometriosis with the Da Vinci single-port robot system, and to provide tips and tricks for surgical skill and efficiency when using this newer robot system for gynecologic surgery. Setting: single academic center. Participant: the patient was a 37-year-old female with lifelong dysmenorrhea, dyschezia, and hematuria. She had failed medical management and desired surgical intervention. The workup included a magnetic resonance imaging that showed evidence of deep infiltrating endometriosis with nodules on the rectum and vesicouterine space. As she desired future fertility, she was scheduled for a robotic endometriosis resection in combination with colorectal surgery. Interventions: the educational video with a narrated approach of a complex stage 4 endometriosis resection, with the goal of completely excising the endometriosis burden while preserving fertility. From the 2026 May edition of Journal of Minimally Invasive Gynecology. Background: to evaluate the feasibility and potential contribution of preoperative and intraoperative ultrasound in rectal shaving to support surgical decision-making and achieve optimal lesion excision. Methods: a prospective, single-center cohort study was conducted in the Lille University Hospital, France from March 2023 to July 2024. Setting: colorectal involvement is the most common form of extragynecological endometriosis, which affects 5 to 12% of women with deep endometriosis. Results: all patients underwent a preoperative transvaginal ultrasound with fluid installation to confirm bowel involvement and assess the depth of infiltration. Discussion: intraoperative rectal ultrasound appears to be a valuable and feasible tool to assess resection completeness during rectal shaving. From the 2026 May edition of Journal of Minimally Invasive Gynecology. Background: to systematically examine the current literature on staged prehysterectomy uterine artery embolization for symptomatic uterine myomas. Methods: data sources, databases were queried from January 2010 to June 2025. Results: the 9 studies corresponded to 34 patients. Discussion: this review is the first to systematically examine the literature on SUAE for patients with symptomatic uterine myomas.
This is Conference Hype. Stay with us, coverage continues.
From the 2026 JUL edition of Journal of Minimally Invasive Gynecology. A 17-year-old 46XX female patient with a history of urogenital reconstruction was found to have perineal endometriosis at the site of previously repaired vaginal stenosis. The patient presented in early childhood with a 2 cm congenital urogenital sinus. At age 11, she underwent urethroplasty and native vaginal tissue vaginoplasty. Following this procedure, she developed a urethrovaginal fistula and stenosis of the distal centimeter of the vagina, allowing for placement of only a 7 French cystoscope. She underwent menarche at the age of 13 with regular non-painful menses. At age 17, she underwent fistula repair and vaginoplasty revision when she was noted to have a nodular blood-filled tissue at the site of the stenosis. The tissue was completely excised and confirmed as endometriosis by histopathology. She subsequently underwent pelvic floor physiotherapy, injection of triamcinolone, and dilation until desired caliber. From the 2026 May edition of Journal of Minimally Invasive Gynecology. Hysteroscopy is one of the most essential tools of the practicing gynecologist. This work examines the progress of hysteroscopy through key categorical technological advances. We focus on 9 key innovations and how they continue to evolve and shape the practice of hysteroscopy, as well as considering implications and opportunities for future technology. Hysteroscopy has evolved from purely diagnostic applications to more advanced therapeutic options for the treatment of intrauterine pathology over the last century. Continued disruptive innovation to improve diagnostic accuracy and the ability to treat more advanced pathology is on the horizon. From the 2026 May edition of Journal of Minimally Invasive Gynecology. Background: without standardized guidelines, the management of thoracic endometriosis syndrome continues to fuel debate. Methods: previous reviews have reported poor outcomes but lack data on complications, hospital length of stay, and chest tube drainage. Results: 28 studies including 1182 patients met our eligibility criteria. Discussion: our findings reveal a clinically meaningful burden of post-surgical pneumothorax recurrence, reoperation, and complications among TES patients. From the 2026 May edition of Journal of Minimally Invasive Gynecology. Background: to evaluate the association between the endometriosis staging and the type and intensity of pain reported by patients, describing the pain intensity across different pain types. Methods: data sources. On January 27, 2025, a systematic search was conducted in PubMed, Scopus, Web of Science, EMBASE, and the Cochrane Library. Results: 2 reviewers extracted data independently, with a third verifying results. Discussion: dysmenorrhea is linked to higher pain intensity in women with endometriosis, while dysuria is linked to lower intensity. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May edition of Journal of Minimally Invasive Gynecology. In this surgical film, we aim to standardize transperitoneal laparoscopic para-aortic lymphadenectomy by dividing it into 10 steps. Setting: laparoscopic transperitoneal aortic lymphadenectomy is a surgical procedure used to assess aortic lymph node status in multiple gynecological malignancies. Its indications have been limited, and its use has decreased worldwide because of its non-therapeutic value and associated morbidity. However, It remains a key procedure for selected indications in gynecologic oncology, such as the comprehensive surgical staging in early-stage epithelial ovarian cancer or debulking of radiologically enlarged lymph nodes. Participants, in this surgical film, we present the case of a 68-year-old patient diagnosed with early-stage right ovarian cancer. Interventions: the patient underwent a complete peritoneal and lymph node staging, including para-aortic lymph node dissection. The postoperative course of our patient was uneventful, and she did not experience early or late morbidity. From the 2026 May edition of Journal of Minimally Invasive Gynecology. To provide a comprehensive educational resource demonstrating cystoscopy, an essential diagnostic procedure in urogynecology and pelvic surgery. The video aims to enhance clinicians' diagnostic skills and technical expertise by showcasing normal and pathological cystoscopic findings to optimize patient outcomes. Setting: this video was created in a high-volume tertiary care center specializing in urogynecology and reconstructive pelvic surgery, where cystoscopy is routinely performed during pelvic surgeries and clinical evaluations. Participants: the video features real patient cases, de-identified for educational use, selected to highlight a broad range of cystoscopic findings encountered in clinical and surgical practice. Interventions: the intervention demonstrated is cystoscopy. The video begins with an overview of normal cystoscopic findings to establish a baseline for comparison. It then presents a diverse series of clinical cases, illustrating structural variations, bladder mucosal abnormalities, foreign bodies, and urethral pathologies. From the 2026 May edition of Journal of Minimally Invasive Gynecology. Background: to establish the cumulative pregnancy rate for the different therapeutic options usually offered to patients with bowel endometriosis-associated infertility. Methods: data sources. A systematic search was conducted using the PubMed, Cochrane, LILACS, and Google Scholar databases to identify relevant studies published in English, French, or Spanish, and limited to those published between 2009 and July 2025. Results: a random effects model meta-analysis was conducted to estimate the overall size effect for each outcome. Discussion: available evidence advocates for a patient-centered approach. From the 2026 May edition of Journal of Minimally Invasive Gynecology. To demonstrate the laparoscopic management of bilateral round ligament endometriosis. Setting: a tertiary referral center specializing in minimally invasive gynecologic surgery. Participants: an obese woman who had previously undergone a hysterectomy with ovarian preservation and excision of uterosacral endometriosis nodules 2 years prior. She later developed recurrent daily pelvic pain. MRI revealed 2 nodules suggestive of endometriosis, a 6 cm long lesion extending through the right deep inguinal ring, and a 3 cm long lesion located 15 from the left deep ring, both measuring 18 min diameter. Her prehysterectomy imaging had shown no involvement of the round ligaments. Interventions: because the nodules were non-palpable, ultrasound-guided percutaneous barbed metal wires were placed preoperatively to ensure accurate identification if visualization during laparoscopy proved difficult, or if conversion to an open approach was required.
This is ConferenceHype. Stay with us, coverage continues.
This concludes ConferenceHype's coverage of the May 2026 issue of Journal of Minimally Invasive Gynecology. Which paper could change practice? What should we cover next? And where do you disagree with our interpretation? If we missed an article, tag on X and join the discussion. Share this broadcast with a colleague or your clinical team, add your perspective in the comments, like the video, and subscribe with notifications turned on so you do not miss the next journal review.